Welcome to the body imaging cases. This is a case of a young lady in the postpartum period with anemia and bilateral hip pain. The chest X-ray shows cardiac enlargement and a couple of findings of the bony thoracic cage, which were in fact the key to the diagnosis. There are bilateral and symmetrical undisplaced fractures with sclerotic margins of the scapulae and some ribs. You may encounter different terms to describe the effect of different forces on bones. An extreme force such as road traffic accident will cause fractures of normal bones. Mild repeated force may cause also fractures of the normal bones, called in this case stress fractures. Examples are rib fractures in chronic cough and march fractures of the pubic rami in soldiers marching for a long distance. The third term is the insufficiency fracture caused by the normal everyday activity effect on the diseased bone. Stress fractures and insufficiency fractures look the same. They are lucent lines surrounded by sclerosis. They are undisplaced and persistent. They share certain sites. For example, the rib fractures can be stress fractures from the effect of strong cough on normal bone, or insufficiency fracture from the effect of mild cough on diseased bone. Similarly, the fractures of the pubic rami can be stress fractures in strong soldiers walking for a long distance, but can also be due to normal walking in patients with diseased bone. We may be therefore a little bit cautious to conclude from the rib fractures that this patient is having brittle bones. But we can do that with more confidence based on the presence of the scapular fractures, because the scapula is not a recognized site of stress fractures. These scapular fractures are typical insufficiency fractures and are quite suggestive of osteomalacia. They have been termed the loser's zones or the milkman's fractures, named after the physicians who described them in patients with osteomalacia. MRI of the pelvis was done to see if there is any complication with the postpartum uterus, and it showed no complications. Additionally, it revealed more insufficiency fractures of the femoral necks and the iliac blades. They are better demonstrated here on T1 weighted images. Note the incomplete nature of the iliac blade fracture. And insufficiency fractures of the superior and inferior pubic rami were also seen on the radiograph of the pelvis. This is the 3D reconstruction of the CT showing the fractures. At this point, the medical efforts needed to go in two directions. First, fixation of the femoral neck before displaced fractures occur, and second, search for the cause of osteomalacia. The first task was successfully done, and search for the cause of osteomalacia revealed the presence of celiac disease, proved by positive celiac serology and endoscopic biopsy of the small intestine showing complete villus atrophy. So we have learned that the bilateral symmetrical insufficiency fractures of the scapulae on the routine chest X-ray have been the clue to the diagnosis of osteomalacia and the starting point of the proper management of the patient. We have also learned that celiac disease, although its name indicates that it is a disease of the abdomen, may present itself only by anemia and metabolic bone disease, and may be first diagnosed on the workup of an adult patient with osteomalacia. The next case is a pregnant lady with acute right abdominal pain.